Malaria is one of the leading causes of morbidity and mortality in Uganda, especially in children under the age of 5. According to the 2019 World Malaria Report, Uganda is the third highest contributor of malaria cases and seventh highest contributor of malaria deaths globally. It is responsible for 10% of all overburden of the disease and 40% of the public health expenditure. In addition, malaria is also responsible for 30 to 50% of the outpatient clinic attendances, 15 to 20% of admissions, and up to 20% of inpatient deaths in Uganda. The government has made significant gains, with disease prevalence dropping by 80% from 45% in 2009 to 9% in 2019. Over the 10 years, mortality has reduced from a high of 20 per 100,000 population in 2016 to 9 in 2019. The country has also registered a decline in malaria cases from 460 per 1,000 people in 2013 to 281 per 1,000 in 2019. Although there is a decline in mortality rate and malaria cases, the ministry says there is still a lot that needs to be done in order to eliminate the disease by 2030.
I think the only intervention that we are tempted to almost bring to scale is indoor residual spraying. And I'm saying almost, because when you say one net per 2 people, unless it is husband and wife, you have not yet done a good job.
The Health Ministry came up with Uganda Malaria Reduction Elimination Strategy between 2021 and 2025 to reduce malaria morbidity by 50% and malaria-related mortality by 70% of the 2019 levels. In a bid to fight the disease, the Ministry of Health has started a survey dubbed the Malaria Indicator Survey that collects data to guide the ministry on how to deal with disease prevalence in the country.
When you are listening to the statistics, it sounds interesting, but when you sit back and think about it, it is very annoying that you can be number 3 in bad things instead of good things. So I hope that all of you here are fired up to end the burden so that we can also be recognized as countries that have eliminated malaria. It is possible.
We shall also look at the community prevention and control efforts, because this is key. And also we'll look at the aspect of malaria vaccine knowledge and acceptance. We'll also look further to the risk factors of malaria parasitemia in Uganda, and we'll look at all these indicators.
The survey will be used to collect data intended to help policymakers and program managers design strategies to improve health status across the country.
When you are losing 4,120 people in 1 year, it is too much. And some of those would have been future very powerful scientists, not to mention presidents.
The Malaria Indicator Survey is intended to obtain national and subnational estimates of the prevalence of malaria, its risk factors, and indicators of programs' coverage behavior, knowledge, and attitude based on a nationally representative sample. It will also provide estimates of malaria indicators for including in urban and rural areas, regions, and refugee settlements.
Within each enumeration area, we shall be selecting 28 households. And this survey is a bit different from the rest, because last time we did listing, but this time we are not doing listing because we just did a census. So we have already sampled the households that we are going to look for.
Look at the extent of the ownership and the use and disposal of mosquito nets, because this is one of the key tools which we are using. The coverage of the IPT program for pregnant women, the coverage and uptake of indoor residual spraying, the practices used to treat malaria among children under the age of 5, and the use of specific anti-malarial medications.
This process being launched today, there's still a lot that all of us will need to participate ahead of us. There's going to be the supervision process, which is very, very important to ensure that we do it and do it well. There is the monitoring process, and also there is the data verification process that will be going on, data analysis, and report writing. Those are very critical steps.
The survey will last for 2 months and will be based on a stratified national sample of approximately 8,445 households in 302 census enumeration areas, and the samples will be taken from children aged between 0 to 5 years.